I'm Dr. Hootan Zandifar. I'm a double board certified facial plastics and reconstructive surgeon practicing in Beverly Hills, California. I'm also a father of two. I have two wonderful kids. I'm married to an amazing wife, and I'm just enjoying life as it is in beautiful Los Angeles. One of my passions is hair transplantation. I love hair transplantation because the patients who undergo this procedure are transformed, and you see it right in front of your eyes. They come here with low self-esteem. They come here kind of feeling bad about themselves. They get the procedure done, and as they see the hair grow, you see the elation on their face, you see the happiness, you just see the joy. And there's very few things you can do that does that for a patient. And often they tell me it's the best thing they've ever done in their life. It's the best thing they did for themselves. And I want to bring this procedure to the entire United States. I want everybody who needs a hair transplantation to be able to get it. I want them to be able to afford it. I want them to be able to do it. To do that, I can't do it alone. So I've enlisted an army of surgeons. I train surgeons from all across the country, and we've created clinics all across the country to be able to bring this wonderful procedure to everyone across the United States. It's always great to see your wife at work.
So Hootan and I met in the hospital where he was doing his residency. I'm a registered nurse, and we met there. All the nurses and residents used to go, out on the weekends together. We became really good friends, which developed into something else.
So what we're doing here is we're using this device, and this device uses sound waves to open up microchannels in the skin, and then allows us to deliver nutrients to the scalp, to the hairs. And so we'll first use it to open up these microchannels. And when we open up the microchannels, we'll put the solution on top, and then we'll drive it through.
I understand his field, and I think that I can anticipate his demands as a surgeon.
Now the solution is packed with peptides and growth factors, so it really helps to stimulate hair growth, and it strengthens the hair that you have. We've been doing this for like a year now, and Lisa's been having really good results with it, and I think that it's helped her keep her hair.
So Hootan is extremely goofy.
And it feels like a massage. Everybody loves it.
Really light-hearted. He doesn't take things very serious at home, and he's a true family man.
It's fantastic. She doesn't get a lot of time off from her work. She's a full-time nurse and works really hard. Every once in a while, she'll get a time off. She can come here, get some treatments, and it really is good to have her here. It always brings up the mood, and we have good banter. Your hair's gonna go all over the place on the camera. You're gonna hate this. I'm sorry. Me and her, we've been together for 16 years married, and close to 20 years together. So it's always fun to have her here, and kind of lightens the mood. So I'm happy that she was here today, getting the treatments that she wanted, and it's great. These are the treatments I offer my patients. I do it to my family, of course. So I believe in them.
Hello.
Dr.
Hi,
Katkari?
Dr.
Hi, how are you doing?
I'm doing good. How are you?
I'm doing good. I wanted to get an update on the conference. Do we have a final number? Do we have the details?
Yeah, actually, I mean, like almost since yesterday, the registrations have really picked up, and now we have almost, let me see, we have 20 registrations as of now. I know that's not what we expected, but we have 20 registrations as of now.
I mean, that's great. We have 20 people, but
Yeah.
I have to figure out because I don't think I can fit 20 people in my office, especially when we're doing cases.
Before you just called me, I was looking into, because I thought like maybe we discuss on that. So I was looking at Beverly Hilton. If that works, they have a place in Beverly Hilton as well.
Okay, perfect. So Beverly Hilton for the lectures is great. If you can make that happen, that would be amazing. I'll make the OR happen. Don't worry about it. I'll call everybody and I'll tell them if even if we have to rent it for a couple of days, that's totally fine. We'll figure it out.
Awesome, awesome. Thank you so much for looking into this. I'll look into Beverly Hilton. I think we can make that happen.
Thank you. I'm excited. This is going to be really good. Thanks, Dr.
Awesome.
Katkar.
Perfect. Thank you so much.
All
Have a
right.
great day.
Bye.
Bye-bye.
So I'm trying desperately to try to find a place to house the hair transplant procedure of our conference. We were able to move the lectures to the Beverly Hilton, so I'm happy about that. The first 2 days are taken care of, but it's now the second 2 days where our volunteer patients are coming in and they're getting hair transplant done, and our student surgeons are learning how to do it. So I really need a place that has room to teach. People can go around and see what's happening and everybody's comfortable. So been calling and calling, and I'm hoping to find someone. Fingers crossed. We'll see what happens. I don't know if I can find someone. I feel like I may have to cancel the event, and I really don't want to do that. These doctors are flying from all over the country. In fact, I have someone flying from Philippines, from all over the world to come and get trained, and I just would hate to cancel it, but it's kind of looking that way. Okay, so I wanted to update you about the conference. Katkar just called me, and we have 20 registrants. And I have no idea what to do because I told them we'll figure it out.
Yeah.
But there's no way 20 people can be in that little OR of ours.
Yeah, I don't think they'll fit here.
I don't know. So
maybe try to call Lee or
Lee.
Skin Tight.
Skin Tight, yeah.
Yeah.
That's a good idea.
That might
All right,
fit
I'll
them.
call her because she has that big room that we could use for even for a conference, and we can use that procedure room, the laser room there. Okay, great.
That'll probably work.
Perfect. Thank you. That works. That works. Okay. So I have great news. Called one of my dearest colleagues, Lee at Skin Tight Aesthetics. She has a beautiful med spa in Brentwood, California, and she's letting us use her procedure room, her laser room for this. It's beautiful. It's wall-to-wall windows. It's gorgeous. It's got lots of room for us to move around. Everybody would fit in. And I'm really happy because I was really worried for a second there that we would have to cancel this, and that just would not be fun.
I have had 3 surgeries before for hair transplants, and today they're going to fill in the scar that they used to do way back when.
Our patient today is Kevin, and Kevin is a wonderful gentleman. He has had previous hair transplantations, and he had a technique called a strip technique where you take a big piece of skin off of the back of your scalp, then you suture it together, and then you basically get the hairs that way. Now that's a more old, outdated technique, and a lot of people don't do that. We do a completely different technique where it doesn't leave those long visible scars.
Nobody really wants to be bald, and my dad always had a wig. And I didn't know. My parents just don't talk about this kind of things, but my brother loses his hair. My mom bought us Rogaine when we were little just to like get it in there. So I always kind of knew it was happening. But as far as the hair transplant, it's just something you don't have to think about anymore. It's just kind of like a non-concern. I don't know if it would give me more confidence or less confidence, but it's just something that I don't have to consider.
So what we're doing here today is we're trying to train a new generation of hair transplant surgeons. So I work with American Society of Aesthetic and Hair Restoration Surgery, and every few months we put together a pro bono hair transplant for patients, and then we invite these doctors who are interested in learning the techniques and the methods of hair transplantation to come and join us for a 4-day weekend, and we focus on all aspects of hair transplants. So we have 2 days of intense lectures where we talk and dive deep into the science of hair transplantation, what it is, why it works, who's a candidate, who's not a candidate, and how to do it. And then 2 days of hands-on training. This is unique in the field. There's not a lot of hands-on training. So these doctors come from all over the world. I think this session we have people from Philippines, we have people from Chicago, we have people from Phoenix and from Las Vegas, from New York, from everywhere.
Are you stepping?
Yeah.
All right, what happened? Out of the way. Hi, I'm Dr. Michael F. Wazorek. I am the CEO and President of Hair Restoration America with offices in 4 states. We are here in Beverly Hills, lovely downtown Beverly Hills, performing a pro bono procedure on a local resident while we are teaching at the ASARH seminar conference for new doctors who want to get involved in the wonderful, satisfying, and lucrative field of hair restoration. I've been doing this for many, many years. I've been in medicine and surgery for 22 years. I've had a hair salon for the past 35 years. Perfect.
1.0 is probably the one you want to start with.
It's very gratifying, right? I heard it.
Yeah.
The one we use right
Yeah.
now, what is the
1.0.
Predates my medical education. I got offices in very affluent areas such as Naples, Florida, and Beverly Hills, California, and I have some areas in the Northwest, in Buffalo, New York, in the Northeast, down obviously in Texas. This is a widely popular procedure, and still millions of Americans, not just Americans, millions of people all over the world suffer from baldness of many forms unnecessarily.
All right, leave those to me. All the way to the end of the hallway.
Once.
It's difficult to get it out.
So just make sure the angle is proper.
Right.
Yeah, that's a good one.
That was a perfect one, little one. Oh, see, we got all these in our thing now, in our tube. Rinse that out.
The process. And this is sharp enough that you see I'm not even pressing
Off the
for long.
pedals quicker.
I just press it and
Now
let go.
there you go. Perfect, perfect. See, there's your follicle right there. Now,
This is
you wanna
such a
keep that thing
nice.
dry or wet, right? So now it's out. It's out.
Okay, so do you guys have the loops? Whoever wants to try it on this side should grab some
Not a
loops.
show.
The best thing about learning from Dr. Z and Dr. Mike as well is they give us hands-on practical information that we'll be able to use in our practice, as well as the intense didactics that was provided in the beginning of the conference.
Yeah, so what excites me the most from learning with Dr. Mike and Dr. Z? They both have very different personalities. Dr. Z's extremely knowledgeable about the non-surgical ways of treating hair loss. They're both very articulate, very friendly, very open to answering any questions. Dr. Mike, he's very practical. He's all about the implants themselves, doesn't really mess with the other non-surgical options. It's great getting both perspectives of different hair transplant surgeons, and I think they're a great team together.
And they come to us and they learn how to do transplantation, and then they take it to their area. This way we can bring this wonderful procedure to all locales in this country and really across the world.